Health insurance is like comedy.
And why is that?
Timing is everything.
Right.
Because you have a specific time period when you can enroll in a health insurance plan.
Oh, right. That would be the open enrollment period.
Yes, it would.
October 15th through December 7th.
Yes, very good.
I'm smart that way.
That little 2-month window is called the annual enrollment period, AEP for short. Outside of the AEP, you can't enroll.
So, if it's July, let's say, and I'm thinking, man, I don't feel too great, I need to see the doctor, maybe I should go ahead and get myself some health insurance.
You can't.
Because it's outside the annual enrollment period.
Right.
So when October 15th rolls around, I need to have my act together and get enrolled in a plan or I miss the window.
Right.
No exceptions.
I didn't say that.
What? There are exceptions?
There could be. If you have some kind of qualifying event that puts you into a special enrollment period.
A qualifying event? Like what?
Well, like you lose your job and along with it your health insurance. Or you get married, or you move into the state. Things like that.
So some sort of major life change?
Yes.
Does getting sick qualify? If it's a major illness?
You mean like, I just found out I have a disease, so I need to buy some health insurance?
Yeah.
No, that's not how it works. Nice try though. You have 60 days after the qualifying event where you're in the special enrollment period and you can enroll in a new health plan.
All right. So the AEP is a fixed time starting in October.
Right.
And the SEP is the 60 days after qualifying event.
You got it.
I do.
For more information, visit us online at www.ncreform101.com.
Hello, my name is Ross Manson and I'm with Eide Bailey to talk to you about healthcare reform and its implications to all businesses out there from an employer perspective, but specifically to employers that have greater than 50 full-time equivalent employees. For those organizations, they are going to have to be taking a look at a number of factors as we move into the healthcare reform environment in 2014. The first is if they offer insurance, do they offer an affordable health plan, and is it an adequate health plan? The second is if they don't offer insurance and send their employees to the public exchanges, they could potentially pay penalties associated with those full-time employees. And then the third is what new marketplace options are happening out there in the marketplace for them to take a look at employer-sponsored healthcare coverage in the future. And we're going to talk about a number of those implications today and the factors that employers need to consider. One of the more interesting facets of the healthcare reform bill is going to be the establishment of public marketplaces for exchanges. Let's talk about how these exchanges are going to work. Because of the individual mandate that on January 1st of 2014, all Americans will have to show proof of insurance or pay a penalty if they do not have a qualified health plan for themselves or their family, there had to be a creation of a marketplace for those individuals that did not receive insurance through their employer. That creation of the marketplace what is classified as these public exchanges. And there are state and there are federal exchanges that are in the development today. These state and federal exchanges are anticipated to have an open enrollment period on October 1st of 2013 and allow people to start to enroll in the plans for effective date of January 1st of 2014. That coincides with the individual mandate. For employers out there, they will have to make notification to their employees about these public exchanges to let people know about the exchanges, how do they access them, and potential subsidies that are out there. Now, individuals that have income up to 400% of the federal poverty level will qualify for subsidies on the exchange, and it's based on household size and household income. So individuals will access these marketplaces, enter in information related to income, their employer, their health status, and there'll be navigators on the exchanges to help them identify plans that suit their needs out there. There is also a small business options, it's called the SHOP Exchange, Small Business Health Options Plan, that if small employers can actually also go to the exchange and offer a product as well too. And that will take effect for next year in January of 2014 as well. Most states have designated that employers less than 50 would be able to develop a plan out there from a SHOP exchange perspective.